Hey everyone and welcome back. As you can see, I'm in front of my backdrop again and it feels good to just sit down and talk to you guys. Before I start going into detail about my medication, I just want to give a huge thanks to Chicky. She sent me this beautiful bracelet. It has a cross on it and it's just and a whole bunch of little roses. Such an adorable bracelet. I just want to say thank you for sending me this, and I'm going to leave her link to her YouTube channel down below. I've actually been following her journey with kidney problems. She's been dealing with kidney disease for a couple of years now, and she's been YouTubing for a couple of years her journey. And I've just been following her along, and she's just a wonderful person. And she kind of motivated me to want to start doing YouTube myself. And I just want to say thank you so much, and you guys should really go check out her videos. She's actually taking a break off of YouTube right now. But when she comes back, definitely check out her videos. Go subscribe to her. She's such an amazing person. So guys, with that being said, let's just hop into this video. So every morning, there's 3 things I always do. I always take my blood pressure, my temperature, and my weight. And I have to do that because I have to keep track of all my records to make sure that all my following stats are always normal. So they don't want my weight to all of a sudden increase overnight 10 pounds, because that means something's not right, that I'm being swollen. Another reason why they take my blood pressure, to make sure it's stable, and my temperature to make sure I'm not getting fevers. So I keep this all down in my kidney transplant book. I keep all my pills in my pill organizer. I'm sure you guys have seen this in other videos, but it actually came so handy. I love it for the fact that it's so big. It's kind of hard to travel, in the sense of if I know I'm coming home late, what I do is just take it out and I put it in a little container. But other than that, it's been really good because it's just so organized, so detailed. And yeah, I just keep all my medicines in here. So I'm going to divide my medicines into 2 categories, my morning and my nighttime. My first one is aspirin. I'm taking 81 mgs. This is used for thinning out my blood so I won't get any clots in my kidneys or anywhere in my body. Since I'm not doing as much movement, they want to prevent any blood clots. My second one is calcitriol. I take this one in the morning as well. I take 0.25 mgs, and this is used to treat low calcium. I was actually on this medicine before my transplant, and they just continued it. This right here is Fervex, better known as iron. I'm taking this to get my hemoglobin and my hematocrit back up, since my kidney is still adjusting to making new blood cells. So this iron is going to help that out. This right here is fluconazole, also known as diflucan. I'm using 100 mg, and this is used to prevent any type of fungal infections in your organs or in your blood. And this one is just temporary. They said I'm going to be on it for about a month, so soon, hopefully, they're going to be taking me off. But this is just to prevent any illnesses, since my immune system is being suppressed. So I'm still taking 2 blood pressure medicines. I'm taking it because the kidney needs time. It takes about 6 months for your kidney to start regulating the pressure after a transplant. So I'm taking nifedipine. I'm taking 60 mgs because I was on 30 and it wasn't working, so they actually increased it. And my second one is metoprolol. I'm on 25 mg, and this also helps with the heart rate and just my blood pressure overall. So that's been working for me. I'm also on Veclizicavir. This is given to patients on a transplant to prevent a disease called CMV, which is an infection of your eye. I'm currently taking 900 mg. So this name is kind of complicated to pronounce, so I'm just going to give you guys the brand name. It's called Bactrim. This medicine is 2 antibiotics combined into one. It's used to prevent any type of bacterial infection. This right here is Tabavite. It's used to prevent any type of vitamin deficiency. It's basically just like a multivitamin. This right here is prednisone. I'm currently taking 10 mg. I was taking 20, but the doctor cut half of it, and hopefully he's going to cut down to 5, but not till next year. This is used as an anti-rejection medicine. So I forgot to record my famotidine, but this is just basically how it looks like. I take it for acid reflux. I'm on 20 mg since the prednisone does cause secondary effects. Sortex, also known as everolimus, is an anti-rejection medicine. This medicine actually suppresses my immune system, so they want me to range between 6 and 8, and I'm actually ranging between 1. So they're actually increasing this, and I'm currently now on 2 mgs instead of 1 mg a day. Hey guys, so I'm here at the infusion center. I'm currently getting belatacept, which is a medicine given through an IV. It's an anti-rejection medicine that I had to take the first time. You have to take 3 to 4 doses, and then it becomes monthly. So this is my 3rd dose of it. I'm not sure if I'm gonna have to get a 4th one, but after this, it's just gonna be a monthly IV. But I have the IV here, and I have the belatacept in there. It's in that tinted bag, so because the light does affect it. So this infusion takes about 30 minutes. So the belatacept is the infusion. I actually take that because I'm allergic to Prograf. It caused me to have seizures when I was on it. When I had that MRI done years ago, it actually showed that it caused damage to my brain, but it's actually been healed. That damage is completely gone because I had an MRI done a couple of weeks before the transplant, and everything looked really good, but they didn't want to take that risk, so they put me on belatacept. And I actually just got informed on Monday that starting March 19th, they are no longer going to be taking new patients in for belatacept unless unless you entered or started the medication before March 19th, then they will continue. But they're not taking for a whole year because they had a severe shortage at their factories. Something happened. They didn't go into too much detail about it, but they did make us sign like forms just like agreeing to receive the medicine. But I just feel so blessed that I'm allowed and to get that medicine, that I actually made the cut, because who would have thought that medicine would actually run out and that they weren't going to take new patients for a year. Like, you don't really hear that often. So I'm just so happy with God and just feel so blessed to like know that I made that cut. So if anybody like has a problem with Prograf and is discussing belatacept with your doctor, you should really talk about that and see what's going on with that, because I know they're not taking new patients for a year. So I just wanted to let you guys know, kind of inform you guys a little of what's going on. Guys, I hope you guys can get an idea of what the medication for a kidney transplant looks like. This is just like an outline. Every patient is different. Mine is different for the fact that I'm taking belatacept since I'm allergic to Prograf, but it can always vary between anyone. So my goal by the end of the year, because I'm slowly going to be coming off these medicines, my goal in the end of the year is only to have 3 medications. At least that's the doctor's goal, so my goal as well. And you know, science is always evolving and changing, so hopefully belatacept maybe one day will become into a pill form and don't have to go and get that infusion, because that infusion is once every month. Definitely a small price to pay compared to dialysis, so I'm not complaining, but you know, if I could take it by a pill, you know, why not? I just want to say thank you guys so much for watching my videos. Thank you guys for liking and subscribing and being so supportive. I hope that I can shine some light on like informing you guys about kidney disease, or inspire you guys to like really get informed about your health and your wellness, because you know, people don't really think too much about your kidneys and how important it is. Like, one key, if I could tell anybody, drink water. Like, it's so important for your body to just have that water. Like, I personally feel like water can cure anything if you're just drinking it, clearing your body up constantly. But it's just so important to like get yourself informed, because you know, you don't really know, people don't really think about kidney disease until it happens to them or until it attacks somebody close to you. So just thank you guys so much. I hope it inspires you guys, and I love each and every one of you guys for just the nice comments that I always get, and people always messaging me through my Instagram or through Facebook. Just thank you guys so much. I hope you guys have a good day. Bye everyone.